Hey, this is Dr. Lewerenz at Longevity Health Institute. Hope you're well. Here in Rochester, Michigan, I just finished up my day and just thought I'd bring you a couple exciting and informative things. Two people, just as luck would have it, and that's why I'm wanted to share this with you. Two people today came in with atrial fibrillation, which is a arrhythmia, a cardiac arrhythmia. And it's where the heart, basically it's an electrical issue typically, but the heart gets overexcitable. Instead of beating thoroughly, sequentially, like top to bottom with like a squeeze, it kind of like beats so fast it shakes and vibrates. It can make your blood a little foamy, make you hypercoagulable. Patients can be a stroke risk and a heart vascular attack risk. And it's fairly common, especially with aging, with any valvular heart issues and with other underlying coronary artery disease. But there's also other reasons, and that's why I want to share this with you. Two patients today. The first one was my actually very first patient today that we've been working on his atrial fibrillation control. He does have a cardiologist. They've encouraged him to have a cardiac ablation. Ablation is where they basically shock and try to break up the electrical current of the heart to get it back in a sequential rhythm. So the heart is beating regularly and smoothly and not kind of at a high rate and shaking. There are risks to it. Actually, death is a risk. Stroke is a risk. And so patients have to be looked at previously and risk, benefit, reward weighed. One of the treatments often is they'll give you a beta blocker and heart medications to slow down the heart. And obviously it's got some very important benefits and it's very efficacious to prevent obviously stroke and keep your heart rate controlled. My part comes in where patients are controlled and they don't like their medicines, or an ablation and their risk is something that they look at other options. An integrative functional medical approach like myself, what we do here at Longevity Health Institute and my colleagues and myself, is that we look at why. Common things in Europe, just by the way, atrial fibrillation is a sign, a symptom of underlying cardiac disease. It's not just treated or band-aid or electrocardioverted or medicated and then left. Often patients here in American and Western medicine, we're just left with, here's the medication you need, here's the procedure you need, but there's a reason why the heart went into that rhythm. The first thing that needs to be ruled out is that the patient doesn't have coronary artery disease, doesn't have a bad heart, doesn't have bad blockage in their coronary arteries. The other thing that needs to be ruled out is valvular heart issues, structural heart issues. One of our 6 components of our functional medical approach is structure. Even in the heart, we have to think of heart and structural heart and valve issues and coronary arteries issues. Once those are ruled out, we can look at details of functionality, metabolically, physiologically, why. I want to share a couple with you. One is if you are inflamed, if you have a lot of inflammation, it can be measured in your blood by CRP, interleukin 6, SED rate. These are lab tests. There's a reason you're inflamed. You have to fix that. That can give you an excitable heart. The other one is magnesium deficiency. It's very, very, very common, and it's a wonderful natural treatment that you can use with patients, and we use with our patients and help patients wonderfully. In fact, this gentleman that came in, that was about 56 years old, who had about 95% of his arrhythmia and his atrial fibrillation symptoms, and he checks his heart himself at home, completely controlled. He's exercising. I did some other things with him that he's lost about 20 pounds since I saw him last, but he's doing wonderfully. He's thrilled. And what do? We put him on high dose magnesium, particularly magnesium glycinate, injectable magnesium that he does at home himself twice a week. And that way he gets good therapeutic tissue and cellular levels. And we also will use high fats in his diet that make you less inflamed. And we're making sure that he doesn't have, in general, inflammatory markers that are high. Very key, very important to look at that with atrial fibrillation. Magnesium. There's wonderful studies on this for atrial fibrillation and arrhythmias. You have to consider it and have to use it. Again, shots, IV, tend to be a lot better than orals, at least to get somebody's rate and rhythm down quicker. The other thing you have to do, and this is my second patient today that's gone in and out of atrial flutter and atrial fibrillation for several years, and she comes to me, she's a little bit older, about 75, that she's been a little bit more of a struggle. The thing is that she's willing to explore this now a little bit deeper after going through her cardiologist, and she had an ablation, didn't work. Now she's on medications that are making her tired. Long story short is that when we looked at her blood today, when we did a little blood and food allergy investigation, she has multiple food allergies. She has something that you hear me talk about a lot that's becoming more of a common lay term, and that's leaky gut. It's a permeability issue in the gut. The gut and the systemic whole blood system can be very then excitable and inflamed by what you eat, what you consume, even medications you take. So this has to be considered in somebody that's getting high heart rates, atrial flood or atrial fibrillation. So you have to, with AFib and arrhythmias, consider nutrients, particularly magnesium, gut health and how you absorb and what's going on with you inside digestively, and coronary artery disease and structural heart disease. So hopefully this is very informative in a very quick, precise, short time. But I hope that encourages you with atrial fibrillation or friends or family with atrial fibrillation that there's hope, and there is successful stories out there with fixing this functionally or optimizing it functionally. So anyway, this is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well. Hopefully this is encouraging. Enjoy the rest of your summer. Be well.